Okay. So as I say, on a kushe on a cabo, on a welcome to the Wel Bodi Beteh Gentri program, where in a saloon, doctors them or people that don't learn book in medicine, and they bring this program to now. Me, na my name is John Fuller. Me, not a doctor. Me a business consultant. Me role within IT. Okay. Me role now so now for just make sure say I help them book my let them bring this program to now uninterrupted. Okay. Today, as soon as you can see, Dr. Turay now they present to us today, and they look at the topic arthritis. They go on an overview. The family them there they ask say, let us understand say where would they present to one person they focus on them, on. In case they get any example with similar to you, na similarity no and by coincidence, but not like so they pick on anybody. Also, we're not able to give specific, individual advice, general advice we're able to give. The reason being, we not get to a medical record. So in that case, we're not able to give personalized advice. So dear, if you get any question, personal question, where you want to ask concerning your own personal health, we will actually see your physician or your doctor. Okay. But yeah, we'll be now, general advice as to what can cause some of the sickness here, how for manage them, when for see a doctor, all that kind of thing, and I already talk about now. Okay. And like I say, Dr. Turay, Dr. Mohammed Z today, now they present to us today. I allow him where they presenting go tell now a little bit about it, because trust me, if I talk, I don't think I will do any justice. Today on Sunday, the 25th of July, 2023, and the people that we go in at the panel at the Wel Bodi Beteh Gentri team. And when I will be done joining before, when I know say we get senior medical consultants, emergency doctors, public health, mental health nurses, we get pharmacists, we get nutritionists. We team well-rounded, so most likely any question we go ask, we must get somebody will be able to answer. Okay. And as I've been saying before about the group, we're in a group of Sierra Leoneans. Them we live right across the world, not just UK. Maybe Manchester now, some Dr. Turay in Manchester, a few people in the around UK, or some day around Europe, some in the America. So everybody all over the place. So when I get a wealth of knowledge and experience from different parts of the globe. But we not they get paid. What will they do so now because of the love we get for the country and make we do one. So dear, if anybody gets way for let this message reach other people, then would they ask, dear, get in touch and see how you be able to help with for reach people them back home. Because some of what they will buy, the facility will get to know they back home and not get them. So if we able to get a way for rich people them back home, we really need this service, we will be very, very helpful. We will be very, very grateful for that. As I say, when the program get recorded, it go there on YouTube, Facebook, and also you can get through to us on WhatsApp. Our WhatsApp number down there, I will share them later. And for the one that we want to join the WhatsApp group, they can join. However, the group not a place for let everybody chat, unfortunately, because we do not want a place where, for example, we know they deal with politics, for example, no one person can begin posting by politics or things that we're not concerned medical stuff. So the only people that will able to post are the doctors and they able post. Nobody else is able to post. So if you want joining a person where you know want that boku message are the best group this for join, because you hardly get information unless information will vitally important we relate to health. Now you will get. Okay. As I said before, the way for ask question is if you look at your screen, you see them this way. If you click on the right side now, you will see 3 buttons them. And that button they will bring up a chat function. Yeah. So if you're in an environment where noisy or maybe you're not as bold or brave as me for team up and talk, you can do you can ask questions. Like I don't know the type on WhatsApp or the chat on Facebook or the same thing, you can chat now. And also if you ask questions, you can raise your hand using the app. So at least I will see say you want to talk, then I will come to you. However, if you not sabi use all here, feel free, turn your camera on. As long as the environment is good for you show your camera, turn your camera on. If you are not, if I see you, I will come to you. Dear, if I not come to you, we cannot mean say they ignore you. It just means I not see you quick. But once I see you, I will try to make sure say I come to you. Okay. So now thank you very much. I can now over now to Dr. Turay. We will take on through the session today. I can say I will share the WhatsApp number later as well for people that we want to join the WhatsApp group. I will also share the Facebook and the YouTube links then for that we go and see all the programs that we don't do before. However, if you feel say something they want to do fine, or maybe I know they talk fine, or maybe there's something they want to change, or now the presents a change, or already group for change, when I feel free for get in touch, when I tell you, because remember, the program we do one for now, not for yourself we do one for. Okay, I don't learn a lot from being here. But on the other hand, not to for myself, I do the program for Una. Okay, so Una tell we how we for make things better. Okay, we not tell anybody so we will be a professional. We all will try no more for make sure say we do something we Una like. So if there's anything they Una feel so for improve, or there's a special topic they Una all talk about, please feel free for get in touch. One last thing though before I pass on to Dr. Turay, at some point Una go see a poll like a survey. We will come up. There are 4 questions then. We will help you for let we self-develop. Okay. So then question will come up there, but I say when I read through the question, when I answer them genuinely, I will not feel. Okay. But I will see them at some point, you will come up towards the end of the program. I just say I should have me. Well, without further ado, I'm about now to Dr. Turay. We're going to take on through the session today. Thank you very much.
Okay, thank you, Fambule. Una ado, tell una thank you for we una join we today. I need to share my screen. Okay. Share my screen. Okay, so I tell una thank you today for where una can join we. Obviously, without una, we're not going able to do this program. We do this program for una sake. All right, so today we talk about arthritis, but before that, I mean, doctor in Manchester in UK. I don't do a lot of work in orthopedics and crossover with rheumatology for over 6-7 years, and then some experience in neurology as well. But then I decide for going to general practice for a couple of years now. There's work as a general practitioner here in Manchester under the NHS. Right, so we topic today in arthritis, and I believe arthritis is now a common topic where most people know. So today we just get a general overview of arthritis because we're not able to finish everything today. And in subsequent times, we get for talk about the individual thing that we call arthritis, and now for go about and treat them. So now, before we start, just as an icebreaker, if anybody then at the audience, Tima, if you can mute people and tell we waiting briefly waiting and know about arthritis.
Hello, Dr. Turay.
Yes.
I have arthritis in my knees, my toes, my shoulders, and my back and my hands, and it's quite painful. I walk with a stick because if I don't, both knees will give way with the pain.
Oh gosh. Oh.
Yeah, gets inflamed.
Yeah, sorry to hear that. So.
Yeah, so arthritis can get anywhere, and it's very, very painful.
Exactly.
It attacks all your your joints in your knees and your shoulders and that. But apart from really painkillers and trying to keep your knees, your arthritis going, we're doing some light exercises. There's nothing else that can do for you. It's just, learning to kind of live with it.
Exactly. Sorry to hear that. And I know you must have read about it. You must have known so much about it now that you've had the arthritis. But today we're going to discuss a little bit more about, the different, types of arthritis and how we can go about to deal with them. In subsequent session, as I said, we would talk about specific forms of arthritis and how we can go about learning how to live with it, just as you rightly said. Any other suggestion within arthritis and what do we know about arthritis? Okay, otherwise we can make a head start. Now, within arthritis. Arthritis comes from the Greek word arthron, right, means joint. Itis means inflammation. Inflammation generally means, pain, just like and they say, swelling, redness, and sometimes it can even lead to loss of function. They get the acronym, or they can get a medical term, say rubor, color, dollar, functionalasia. So you get different until it can lead to inflammation. But we need for differentiate this from what they call infection. Infection, now where you get bug, or in Salo call it jams, they in your body. In this case, maybe jams they inside the joint or somewhere. So arthritis means joint inflammation, not a joint infection, inflammation. However, as we can see later on, the presentation may look so similar, like you go feel saying an infection when it isn't an infection. Arthritis, again, a very common condition. Most people, I'm sure in the audience, will know about them. Like how Anne say rightly, they cause severe excruciating pain at the joint, and it can affect people of all age, not just people of elderly age. Even picking with them, but they get their own type of arthritis, so then they get. So now let's talk about briefly with around the world. We know about arthritis, the prevalence, for instance. We know arthritis worldwide, you get different types of them. The most common one are osteoarthritis. We'll know about them later. Nine are the most common even around all over the world. And it affects women them much more. So now it affects like 10% of men around the world and 18% of women around the world. In the UK, for men there, or people, adults over the age of 45, 8.7 million of the UK population get arthritis. In the US, according to the CDC, 32 million adults in the US get this condition. Now, the prevalence, how much it common to people, then depend on the joints were affected. Like how in Iran, they say, different joints then can be involved. So based on the joints that we evolve, again, they tell how the prevalence the day. Of course, as they grow older, the risk of you getting arthritis become much more higher. Now, for the knee joint, where the mostly you get the arthritis from, 18% of adults, like in the UK studies, get them. In the hip joint, come next, we get 8% of the people then. Then next, you get the hand and the wrist. If you take that order, the people already get about 6% of the UK population get them. And the next one after that, you get rheumatoid arthritis. This one, not too much, they affect beaucoup people. However, it cause a very debilitating rheumatoid arthritis, and then two different. Some people call it rheumatism, and say, but it's different from osteoarthritis. We'll know later on. And this can affect at any age, basically, but mostly between the 30s and 50s. Now they affect. In the UK, now 1% of the population they're affected. And people who then get rheumatoid arthritis, then can somehow become debilitated, and they even stop for work maybe 2 years after when the arthritis, then the rheumatoid arthritis don't start running serious one if they know handle quickly and try for help for manage the person in condition. Now for Sierra Leone, the prevalence we get searching around, we made to understand about 10 to 20% of the adult population in Salone then get them. So if you just compare to the world population, what they talk about previously, if you see, and I will see 10%, 18%, but Salone, 10 to 20% of adults then get them. And the current population of Sierra Leone, according to the United Nations data, is about 8.4 million. Okay, that's current in 2023. That's the population. So this accounts for like 0.1% of the world population, than the population of Sierra Leone. And again, as we say, worldwide osteoarthritis is not the most common. In Sierra Leone, osteoarthritis and rheumatoid arthritis, now they are the two most common conditions. And if you take of the arthritis, them different one we'll get for talk later on, in percentage wise, osteoarthritis 16% of the people in a salon. So that means like 1.4 million people in a salon get osteoarthritis. Some know, some don't know, some late diagnosis. And for rheumatoid arthritis comes second in a salon. It gets 700,000 people about of them. Now they get an salon. So 8.3%. And in gout, you get like 3.3%, which accounts for like 279,000 or so people in a salon. Now they get gout. That the one the way maybe involved in the studies, or they maybe then do then they go meet a doctor, then they make official diagnosis. Then you get another form of arthritis which can happen mainly with the back, or so what they call ankylosing spondylitis. This is more common with young people. You get 1.6% people in a salon get them, so 141,000 or so. Then you get psoriatic arthritis, where less number of people get them. Psoriatic arthritis, psoriasis, for instance, more common in the European and Western population, much more. Now, the reasons we didn't try for propose are as follows. Because of the low socioeconomic condition as alone, people then they tend for do more manual work, physical work, young guys them. So as a result of that, then they put so much strain that they joint them. And some of them, just they work, they hardly ever go see specialists for really say let them go check them. And some by the time they go now, it don't late. And when they go the diagnosis, it go on late, and sometimes I for just manager for live with them basically. So these now one of the one condition reason we then give why salon population get that so much high number of people with osteoarthritis. I mean, this will reflect to the whole of Africa, not just Sierra Leone. All the whole of the the third world, and you say we poverty and everything, people get for use manual labor, and they know they access the healthcare services, so then they go meet the right person for diagnose them or for treat them. And then malnutrition, again, another reason. And infection can be not just for Salon or for Africa, all over the world. Things like HIV, STDs, and everything can lead to different form of arthritis. So we need for know again with genetic condition. Now, so let's talk a little more about the joint itself. So basically, waiting from a joint, you get two or more bones, then the joint meet form a joint. Like for the knee, for instance, you get like 3 bones, then you get the 2 bones, then plus the patella away from the knee joint. So you get bone here, bone down here, and at the end of the bone, you get some kind cartilage, then call them thing we cover them, so that the bone and bone no go meet together. And for further protect this bone here, you get a membrane, hard rubber band, I can call them, with a fibrous capsule with the surrounding the whole joint. Right, this they tend for make the joint stay in place. The inside the capsule, they get a thin layer membrane, like a thin close with the inside, where they call it synovial membrane. So this synovial membrane, now they produce, fluid. Where this fluid there, it generally they for lubricate the joint and make sure the joint they intact, they meet each other. So because the bone they meet each other, they get pain, you work, they feel yourself, you get anything with your pain with your joint. Now forget the movement of the joint, you get the muscle where they join to the bone, and the rubber band from the muscle where they join to the bone and call it tendon. Okay, so now then they move, as the muscle they move one to the other, they cause the bone for let A, cause the joints for let A move. And then you get also a rubber band where join one bone to the other. With this one not to the capsule the round down. We get another strong one, we join from one to the other, we then call a ligament. And then ligament, they try for maintain the integrity of the joint. And again, for further protects this joint here, waiting the creator make for them, make what they call a bossa, like a shock absorber, where cushion, where they round the joint. This cushion, there's so many, any joints getting cushions, and they sometimes then cushion and they can be inflamed, what they can call bursitis, where you can just see some parts by your joint, they swell no more like that. Okay, they can inflame when I just inflammation, and sometimes if not, it can lead to infection. But that not what we talk about today. We talk mainly just about and the joints and the different things that they happen to them. So in a nutshell, these are the joints, and you have multiple joints them in the body. Now, as we say, the two major types there, we don't talk about them. You get all that different types of joints, arthritis, and things that we're relating to arthritis, apart from the osteo and the rheumatoid. You get things like gout, pseudo gout, we'll talk about them, and psoriasis, I don't mention, reactive arthritis, we'll therefore talk about, and polymyalgia again. And then you get some people who can get some kind bowel problem, when an inflammation of the bowel, they call it inflammatory bowel disease, Crohn's ulcerative colitis, where as a result of that, they can end up getting some joint problem. But however, the joint problem then they get not a specific now one joint. They move from one joint to the other, and then at the all the time again, it can be seen at the small joints then at your body now in they be involved. Okay, so and then you get this what they call cervical spondylosis, where now in the they with regards to the neck bones then. However, we'll talk about that in a bit. Then you get fibromyalgia, when the muscle, then the ligaments and the tendons, what we talk about, sometimes they can be inflamed and you can get problem. Then you get septic arthritis, when an infection, this one are the infection inside the joint. Then you get lupus. Lupus now a type of autoimmune condition wherein your soldier in your body, your immunity, they target different parts of the body, causing inflammation in that part of the body. This can affect from your head to your toe. It can lead to losing your hair. Okay, it can lead to ulcers then at your mouth. It can lead to a rash. You get two major types of them. You get the what they call discoid lupus erythematosus, when mainly the skin they affect, and you get the systemic lupus when they affect from head to toe. This why what follow we know probably at some stage we will talk about in more detail, because it's very much common with African, Caribbean, Asian people, less common with the the Western or the Caucasian people, but with Africans it's very much common, and it's 6 times more common with women than men, and it can affect from any age, from 15 years onward to even the 40s and 50s. You see, and a very serious condition. This, if you work in rheumatology unit, you see them people there, can end up, they give them some kind of serious medications, then biologic medication, then like infliximab and the rest, for calm the immunity. It affects the everywhere, the kidney, then they become anemic, and so and the diagnosis again depend mostly on the history and some investigation that they do. Then you get arthritis, what can happen as a result of something, like somebody get accident. You get accident, then go operate them, then go treat their the accident. If it involve around the joint, it can later on in life get arthritis. Then you get the arthritis what they occur with picking them. They call it juvenile idiopathic arthritis. Idiopathic means, juvenile means picking them. Idiopathic means you don't know really what they cause them. So in the happen to small picking them from less than 16 years of age. And again, that arthritis, they can come from different joints them. It can be so much debilitating for the picking them. So then you get the ankylosing spondylitis, which mainly in a form of arthritis in which it affect the spine. If they do X-ray with that kind of person, we get they get what they call a bamboo spine, wherein the bone then they straight together. They need to get the normal coverage, or we don't suppose forget. So this is not just a few. You get over 20 or 30 or 40s of different type of conditions that will lead to arthritis. As I say, we're not able to talk about it all today. This is not psoriatic arthritis. This is not a condition in which you get certain area of your skin, they produce more skin than the other. So you end up getting psoriasis. This people and they get this kind, a very difficult for treat. They get for take so many creams them for let you go manage than they can naturally happen with some people. But later on, then they end up getting joint problems. If you see them fingernail them, they get different to how their fingernails they look. and so then they end up getting a joint problem. This is a skin condition where they lead to arthritis. As I say, we need to talk in details of everything. Then you get what they call gout arthritis. Gout now basically a condition in which we get what they call everybody in body will they produce a certain protein, either through food or from your liver, what they call purine. You know, that purine they've been broken down to what they call uric acid. That uric acid, once acid they produce in your body, it end up for being secreted in the kidneys. So naturally your body they tend for maintain them. But if you get a condition when when you excrete the excretion of this uric acid, they be less, or they become produce more uric acid again in your body, then it build up and they form crystals, and then crystals then they develop and they get a predilection to certain joints, like like the toe joints and other joints there, even the organs that inside your body. So then they go deposit there. Then the deposit mainly at the side. Then as they go on, it cause inflammation. You see the redness, swelling, pain. This can cause excruciating pain. Honestly, you will get this one. Don't say wake up in the morning, no more. You say you get your toe they at you, or you knee they at you, or you finger they at you. It is so much painful that they able, if they go walk, go walk that day. Go even put your foot down on the ground because it's so much painful. Then crystals they wouldn't form, then they deposit now the joint. They form inflammation, and then inflammation they sometimes it is, as I say, a similar presentation to if you feel saying an infection you don't get, we know to infection you get. So it affect you, and these can cause you severe pain. They see like this person in foot now, it affecting all foot, they even able to go. It deposit under the skin again, what they call tophi. It can affect also your fingers that you under, like when they see now this person here, how so badly they affect in thing. Then in addition to that, you get another form of arthritis, where we then call pseudo gout, where basically this one and then to get almost similar presentation, but the pseudo gout they affect more the big joints them, like the knees them. Right? Why this one they affect mostly sometimes the small joints them. So then it affect mostly the big joints them. And waiting to happen with this uric acid, this one gout, they get waiting and call the kind crystal already in the form if like needle, as we will see before. So this one are the pseudo gout. If you take like this now the normal joint, right? It gets in fluid the inside fine. In pseudo gout now, not a uric acid crystal form, they call them calcium pyruvate crystals, them not in the form, them fiber like like they get a rhomboid shape or box shape, as opposed to the uric acid crystal with fiber needle. So these are the two major ones, and most people them when they get them kind of arthritis they are, especially mostly pseudo gout, they go between in hospital, say like saying a septic arthritis and get, which is not septic arthritis. They present mainly like septic arthritis, but not. And only 1 out of 10 people who can normally go meet orthopedics or then go to hospital and A&E say they get septic arthritis, we actually in arthritis they get. Now septic arthritis mostly in a pseudo gout they get. And if then what normally they can do when you take you go to lab, the way you go to the doctor, then they take some fluid through the joint, can go to the lab, and then inside the lab now then go see them crystals there, the fiber like needle. So you see the difference. This one fiber like box, and then the fiber like needle, and this explains to you why the gout is so much they cause pain than any other one. It's so much explain like needle they choke you and it cause the inflammation. So this now the needle the way they see so now then they affect the joint, the side of the joint. They affect the joint, so it cause that severe pain. Then if you look X-ray, if you take an X-ray, because normally we go to hospital and they take X-ray for see the joint, then they see that calcium pyruvate crystals them, then they deposit now your joint, they call it chondrocalcinosis. I mean, for the medics around when they do the report, then they clearly tell you say this is not pseudo gout actually, not to gout itself or not to septic arthritis. Most people then get that and calcium pyruvate crystals and deposit na most joints then. So then they get under the shoulder. You can see no more your shoulder. It just the pain no more. You the mover, you know jammer, you know do nothing one good time. You see it the pain no more, and it can be so hard, difficult at times, because it affects your movement as in some cases. Dandy can normally happen, when they get that and crystals and they deposit. Sometimes then you need a steroid injection and for help. Then you get another form of arthritis, we then call reactive arthritis. Initially, they be used for calling Rita syndrome because you get one doctor we then call Rita. We find out how them people are mostly in the term the way Second or Third World War, with them the First War, even mostly with the military people then. And found out say the people that will get this condition, then they get pain when in the pee. Then get like saying a water infection, or they get some kind of discharge and through them private part. Then in notice say most of the people when they come back, then they get infection at the eyes, when they call conjunctivitis, and then they get pain at the knee. So he make this and he publish and then start for diagnose people in that condition and they call and say, well, this one they call the condition as Rita syndrome. However, presently we know say these people are not the only present to them 3 things a day, right? The conjunctivitis, the infection at your eye, and your wee area and your knee. It affects other areas them. It can affect multiple joints, it can affect your arm, it can affect different parts of the body. So, and again, people and they would then go get reactive arthritis where they not get all them conditions and they don't just get 1 or 2. So now they call it reactive arthritis. Now, these pictures you see now a case study of a 40-year-old gentleman, where then published in the New England Journal of Medicine, a case study. This man can present with mainly a no can see to doctor. We come because of in foot. He get this skin problem now in foot. And then later on, we get this rash, and you get for notice it get pain in knee. So now then they actually go for. And then later on, then do more investigation, ask her more in a story. They notice a few days back, if you don't get this problem, discharge they come out through in penis in private parts area. And then the examiner notice it gets this what they call glossitis, a mouth ulcers inside a mouth. And this skin condition at the foot, normally they call keratoderma blenorrhagica, like kind of skin condition we more specific with this type of reactive arthritis. So this they further investigation and notice if you don't get infection somewhere, and reactive arthritis normally they happen as a result of infection where you get somewhere we come to your joint. For instance, you get sexually transmitted infection. You get unprotected sex to somebody, you get gonorrhea or chlamydia, then they can lead to this kind of condition. HIV can lead to this kind of condition. And somebody they get just gastroenteritis, bug in his stomach, and either salmonella, shigella, or campylobacter, running stool and everything. After 1 to 3 weeks, you notice it gets joint pain at your knees and you joint them. Then they call it again reactive arthritis. Then again, some people when they're just bad cold, you get bad cold, you get 1 to 3 days, you forget about that. Then it can begin get problem with your knees and with your joints them, your hand joints and other joints and fleeting and joints and then they again they call it reactive arthritis. And it more common, with picking them, we can normally see them mostly in a hospital, picking them like cold till then they get transient synovitis, then can no more you picking ammonia begin limp. If you don't get cold before, it can mostly when they come, parents and they worry they feel them picking don't get infection at the joint. We're not to infection again. We're not just inflammation as a result of that infection we don't get elsewhere. Right? So this is reactive arthritis, again a very common and mostly a common with sexually transmitted people. Then you get the arthritis with an infection, basically an infection. This is not infection inside the joint itself. And when you take that, you see that's what it look like. It affect the whole joint. You're not even able to move them. You not even forget small movement of a joint. Then they should say yes, infection. Then you get fever, you get other conditions and back. Do we get anything in the advice is for see doctor. So it affects any joint. It can, this one at the hand, it can affect your knees as well. This now so they present like a knee. And again, the reason why you need for see doctor, the need for exclude now, is it gout? Is it pseudo gout? Is it septic arthritis? You know, other things and then go look look into, rather than you start for treat yourself at the corner, you need for say specialist, we go investigate and examine you properly or find the reason. Then it can affect again the hip, where affect the hip. This septic arthritis now one of the orthopedic emergencies when it happens because it can damage the joint rapidly in few hours or seconds or minutes. So now one of the emergencies, and once you notice them, then go to call arthroscopic washout, or we can normally do for wash the infection out, not taking antibiotics, not declare than they get for go, you wash out, you clear the infection and give you antibiotics now for let it calm down. Otherwise, it damage your joint will lead to some other consequences. Then you get fibromyalgia, in which it affect different joints them. This why you see some people and they wake up in the morning, no more they feel then joints they all they stiff, you need them for moving joints, painful, mostly they affect your shoulder, they affect your hips them. This one of fibromyalgia can normally happen. And again, this you need a whole topic, a whole session for discuss about them. It can happen with people in the 50s or more. And people who then get them again, what the doctor see, you get what they call giant cell arthritis, where you need for look into for exclude them, because that giant cell arthritis, if not happen coexisting with this one, it can lead to blindness if they not treat them with emergency. See, so this one can be so debilitating, affect so many joints them, mostly your shoulder and your hips and your other joints them. Then you go then called cervical spondylosis, in which you get the arthritis now you neck. The cervical means the neck. So it cause some part of the bone they overgrow, like you can see here. Some part of the bone they overgrow, and the disc in between the joints, right? Sometimes they become bulge out, and or the disc they become degenerated, they spoil. And this waiting they happen, they press on the neck bone. So when they move, some man they move the neck, they make crack 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 sound them. And then as the nerve, when the spinal cord they pass through, you get nerves that they come out through. As the nerve they come out through, it depends if that bone them or that disc in between they press on them, it cause you pain and impingement, you know. And if you not touch the nerve at all, then it will cause you no pain. But if it cause they touch the nerve like Yasu, if you look this one at one spine, it look from the top. If it touch this nerve, it cause you to get pins and needle, not the distribution of that nerve there. And the cervical area, the neck area, mostly they distribute to your hands them. So they get some area, normally they get pins and needle, you know, numbness, now some fingers them, some hand parts by you hand them. When you move your neck, it makes sound them. Now arthritis until they don't develop, they will lead to all anything and day. Now, if for instance, the bone growth or the bulging press on the spinal cord itself, this they get a condition we call myelopathy, right? In which case, it cause you problem with, like say, if not the back happen, it cause you problem with your wee, with your bladder, and I mean clumsiness even when you move your feet, you hands them, the way they move your foot them. It depends. So if you press on the nerve spinal cord itself, then call it myelopathy. If not just the nerves, then a press on, then call it radiculopathy. Now, this is how they present. Because they press on the nerves distributed to supply the hands, they cause pins and needles around your hands. So that's how they present. You get this neck pain, as you see this mania, they get this neck pain. And then with time, it distributes calm down. See some man, they healthy, strong, everything, just they feel no more some kind of pain when they come. Possibly sometimes This could be the reason. Then it can happen from your neck, it can happen in your back. So this is the back way it can happen with most people. They make them, they go to hospital, they want MRI scan, they want a scan for the back. Sometimes not just the muscle, sometimes not sciatica again. But the most important thing, if this they press on the spinal cord, what they call the myelopathy, where they cause the bladder and bowel problem, now emergency, it need for be relieved. And that surgery then they can normally be serious and long surgery. So this is again how it appear. So sometimes now arthritis, now your spine you get, now it cause the pain as a result. Now, then you get let's say this is not the normal joint as we can see them. If somebody gets osteoarthritis, okay, osteoarthritis, what think can happen in the cartilage inside the joint? You see like this one, now it don't damage. So now I make them call them wear and tear. It don't damage. So they get bone and bone the joint. This meniscus, they destroyed. They call them, the shock absorber of the knee. They destroyed. So they get bone and bone. So when they waka, they see the bone and bone, they meet, you need a cause, cracking, creaking sound them. Then it painful where they waka as they go along, so because the bone and bone are already they meet. And it depends the way where it meets, now so then they treat them. So thinking then one area of your knee no more, they get like the inside of your knee. We're thinking cause that now because of sometimes your posture. If you get your foot like a knack knee or you get certain posture where you take, able to maintain your posture properly, you put more weight now one side of your knee because you need to carry most of your body, it put more weight on them. So this area they damage with time, they get arthritis, they develop that side. And so again, the way they treat that day is different because you don't change the center of gravity. Now, as opposed to rheumatoid arthritis, this is an inflammation process now, wherein you autoimmune, so German they protect your body. Which then they do, then they target the joint. Then they see the joint like say a foreign. And which part of the joint then they affect? The synovial area, the synovial, the capsule round. Now in then they affect, right? So in they start from outside, the inside of the joint can normally preserved, right? So they see because in the damage the joint from the outside, later on the joints they take different form. And difference there between the osteoarthritis and the rheumatoid arthritis. The rheumatoid arthritis, now this thing inside, the cartilage inside, now the damage. But in rheumatoid arthritis, now from the outside, because now inflammation, and then it affects multiple joints them. Whilst in osteoarthritis, now just one joint sometimes can be involved. While in rheumatoid arthritis, it can normally be say symmetrically they affect like your hands, they will be both hands, the knees they will be both knees, the ankle it will be both ankles, will be one side, mostly not both sides, and normally then they affect the small joints then. And because now inflammatory process, it gets strong family link we attached to this. And again, it can affect younger people as opposed to osteoarthritis, where they affect elderly people. And in osteoarthritis, the elderly and the male female sex normally can be sometimes equal. And then they get morning stiffness where they happen more with rheumatoid arthritis, where you gap in the morning for lay you left gap na you bed. It can be like a big walk for lay come on I bed. It is stiff sometimes up to 1 hour. It they no more your body stiff for lay you take that first movement. And you get the same thing osteoarthritis, but it need to be last more than 30 minutes. You're able to keep going basically, and so because now autoimmune, certain tests they can do. You see, so this not osteoarthritis, it affects here, while this one they affect the outer side. Now this not the presentation because now the outside it affect, it see how the person and they be. So if this person here now na mechanic, if this person here na builder, if this person here na seamstress, or they do some tailoring work, and don't turn this guy away, I go able for continuing job. If you do X-ray, see how the joints, the multiple of them joints that they become affected. You see, so the way for treat the one they are maybe it really difficult because sometimes they need for take medication for calm the immunity. you know, and they need to take a lot of different other medications and just because na autoimmune condition now you sujamande na body and they affect everywhere as opposed to osteoarthritis. So these are the two major differences them where Abido try for highlight. And again, Abido talk about this one. Osteoarthritis more common, you know, in the mid-40s, and so less than 1% of people, 1% of people then get them, you see. So, and the joints then symmetrically they become involved. Now, osteoarthritis now, the causes. Mostly the cause sometimes, you know, in most cases they don't know. But however, you get risk factors, things that we can lead to you getting osteoarthritis. That's not the wear and tear. The rheumatoid arthritis, now where you get the sujaman, the attack joint. So this one, either can be say when they get injury to your joint itself, and as we be the talk in the prevalence for Sierra Leone, say due to the manual work, heavy work who people and they put strain to the joints them, then they all can lead to arthritis. And if you don't get accident, and then after the accident, you get for they do operation by you, then they can lead to secondary arthritis, or they don't do any knee arthroscopy or knee problem or joint problems, hip problems, but they don't go injector or they don't go do certain things. That all thing they can lead to you getting secondary arthritis. Age, we know it common with as they go old, now so the naturally you tendency for let you get wear and tear of your joint, they happen. Okay, and if you get other conditions like gout, we don't talk about pseudo gout, it can lead to arthritis, osteoarthritis as well, and it get family link. If somebody get big body, you know, it get big body, overweight, you know, they maintaining weight, it puts pressure on your joints them as you walk about, and then you're able for get good shoes or footwear with the cushion their weight day, it end up getting arthritis. Osteoarthritis. See, the way that they diagnose are normally in any form of arthritis, not to say no more the doctor they go no more go look you joint and begin move them and say oh na arthritis you get. A need for firstly try for find out which type of arthritis you don't get, and because the treatment different to all of them, and then a need for which associated to the arthritis we get. So the exam you need to take first your story. You need for explain to run the true correct story within the happen. It ask you about your family, if arthritis common day, which type of arthritis. So it fine for let you know in your family if somebody of your family get like rheumatoid arthritis or you get systemic lupus or lupus arthritis, erythematosus, SLE. If you get them, you need for mention anything to your doctor, because then they help them for find out and narrow down possibly the reason, not only dealing with that pain problem we out for deal with other things we can associate with them. So they take a full history about the pain, because the way the pain in arthritis they happen, again they tell the doctor which kind arthritis this. Like I mentioned about gout, it suddenly just kind of more excruciating pain. We know that. And then the pain with osteoarthritis as they walk along, become aware and tear, they get more of that pain day. In ankylosing spondylitis, as you walk, and then funnily in a difference than to the other one, the ankylosing spondylitis, as you exercise, now so the pain they become less. But as you do exercise, we can't don't abate na net. Oh my gosh, now that pain they get for be so bad for you. You know, mostly at the back and the other joints, like even affect your eyes as well. So they take all their history, then they which time if they get stiffness in the morning, and if you don't get infection early, like you know, cold, or you don't get sexually transmitted infection or discharge to your private parts where you know aware of, or where you know feel safe, then they important. All their history then they important, and how the infect the pain we get there. If they move from one place to the other, you know, just staying on one side, it will be able for no say this now migrating type of arthritis and how for deal with them. Then it get for examine you from head to toe. Like I say, you look in the ear, because in SLE they lose your ear, and some of them like rheumatoid and other form of arthritis, ankylosing spondylitis, they affect your eyes. as well. So they look you eyes them, they look you and examine you fingernails them for see in psoriatic arthritis, they get a pitting type of presentation, I nails them. So they look examine you from head to toe, then do some investigations, then x-rays, then that x-rays, and they normally sometimes now for exclude other conditions that we can happen, we can associate with them. Yes, the x-ray they show wear and tear in some cases, but if you get saying that the soft tissue around you joints now affect get problem, x-ray they help you that side. Okay, in that case, see something you can go advance further for do CT scan or MRI scan. In which case, if you get like that arthritis now your back, or you don't get bulging of your disc, MRI scan they help, not a CT, you know. Then they help, although CT self can help, you know. But then they show soft, then they show the become a magnet, they show more the soft tissue than the other. And then they do blood tests. The blood tests will see if the autoimmune or other conditions. So it's not just about the joint we bring can to the doctor. So many other things than the way they look into before it go into and saying that this you get a low begin manager. So most of the like osteoarthritis in general, you get for take painkillers them, you know, paracetamol, or because the NSAIDs they are, we get for be careful when we take them, because the NSAIDs they normally can cause irritation of your stomach. So you get for take them, you know, and sometimes you get for try for able for live with them. Then get what they call capsaicin cream we can apply fever like Bεtε. Initially difficult to apply them, but as time goes, it help you joint. A very expensive and okay normally prescribed. So you go meet your doctor, say prescribe them for me, it can differ, especially if you're under the NHS. You will buy them, maybe, yeah, but it's very expensive, so they're not normally prescribed. So then the next day they can do injection. Therefore, the steroid and injection are anti-inflammatory for help reduce the problem where they get. Now, things that we can do for help yourself, right? You try for minimize and try for live a healthy life. Do exercises where they will help you, you know. Aerobic exercises they normally advise, things like cycling or the waka fast, or you know, or swimming, basically where they able for control yourself. But then excessive weight bearing exercises them we need for know how they do them. Except that now your profession, but you need for do them, but you get for do them with some limitation because they put strain on your joint, like how we don't talk. So for lose weight, these are the things that we need for do back. And when they do exercise, no feel say they do on 1 day, 2 day, you joint all things for those solve. You get for take as part of your routine. Now it will able for help you. A posture, I can't emphasize it more. How posture they cause people to get arthritis, then you get pain. Maybe they're not supposed to get if they don't maintain their posture. So the more you maintain your posture, then they help you and for let you reduce the weight in a certain joints them. And if you get too much weight, try for lose weight, then they help you. Then you get supportive things that we can use. This is not TENS machine, where this is not a machine where they get some kind cable where they come out and call them electrodes there, where they come attached to a pad. Or within this they do, they try for deaden the nerves, the nerve endings them, for reduce the information where they go to the brain for let you where they make you get the pain. So sometimes people in the use then TENS machine there, then they help you for reduce the pain where they get, because it's mainly about managing the pain, try for live with it, and when it reach to a very poor situation, they can get some surgical input so they can do. Then it can do then supportive footwear there we can use devices there. You get forget some kind of footwear, we get some kind of shock absorbing sole where they help for relieve the pressure inside your joint, with the pressure of your joint as the waka. So you get certain, if you know say your foot bend, sometimes if you look your shoes, just take your shoes, you open them, you see the sole of them. If you see say one side by your shoes, they link by the other, that shows say all over the years you don't put pressure by your foot or your joint now one area. So try forget that shock absorbing sole where they distribute, spread the weight where will get more pressure per one side of your body than the other. So that's the essence of the supportive device there. It can be up on the knee. Again, it help for distribute the weight evenly so that one side of the joint, like I'll be showing on one picture where the inside of the knee, 9 more we think of, one side of the joint, they get more of the pressure than the other, where they lead to that side, they lead into arthritis. So for distribute that, now make it, they do then devices there. And again, the same work come with the walking stick for reduce the weight. You know, we get walking stick, again, they help for let you able for reduce the weight in the other side. You get different type of supportive splints that we can use. You know, in hospital, they give most of these, and sometimes they do it after arthroscopy or other knee procedure or whatever, then they give splints for just immobilize the joint for some time. And not so for all the time, because if you mobilize your joints for a long time, you don't move them, the muscles around and the ligaments and tendon, they become stiff. And then at the thing we don't want. The joint you need for move them. It's painful, but try for good small movement of the joint. Otherwise, you end up getting stiffness around the joint, where they cause even more problem than the actual joint, either say arthritis you get. This why like that do they get tennis elbow or golfer's elbow, you get this braceweight can put naya, where it help for distribute the weight again all over. So then massage, physiotherapy, massage, like people who get cervical spondylosis, massage and physiotherapy and neck movement, they help you a lot. So again, if all anything they don't work, they can do operation. They can start first. If they don't do the injection, say it don't work, and they can start by doing either arthroscopic washout, or they clean inside the cartilage, or then they pull them, and then if not, they can do a replacement of your joint, or if you do so bad, then they fuse the joints now, fuse them because let the joints not move. See, so like for instance, I'll be talk about this one. If somebody get this, for instance, because the weight they on one side, they distributed, they get this area more being affected. See, so if they do X-ray, if you get this type 1, now you know more than one for maintain the other side, we kind of operation we normally we can do, then call a unicompartmental knee replacement. So now just take 30 minutes or 40 minutes or so for do them. For let you replace, you pull this part of the joint, you pull you replace them with a prosthesis where they reduce the joint to joint and bone to bone connection. Then it reduce the pain, basically. As opposed to if somebody get osteoarthritis, so we don't see we all side that they need of bad off, what will they do for that person? Would they do total knee replacements? Because it don't bad now, don't try all conservative measure, mostly the outcome can be so good. However, you get complication, it can happen so after 5-10 years or 15 years, you get a septic loosening, we then go need for do a replacement surgery and replace this prosthesis again. Okay, and the people can do acupuncture, but will not get evidence for justify that. So as we talk about exercises, these are few exercises where we can do for help with. Now, if you get a chair and os, you can do this exercise for raise you for do they say straight leg raising exercise, where you can do either sit down or lay down. You can sit down na a chair, you straight your back, right? And then you take one knee, the knee way you want for exercise, or the foot way you want exercise, you lift her up gradually, like this woman sit down. You lift her up from the floor gradually, you keep her up there, you count 10. Slowly you count 10, then you put her down. Then you do her back up to 10 times. Then you can do now the other foot. You can do this either you sit down or you lay down. You can lay down on your bed or you lay down on the floor. If you lay down on the floor, where it really sometimes better, you lay down, you bend this one, the knee way, the foot way one for exercise, in the they keep straight. The other one, they bend to 90 degrees. Then you they lift this, they help your foot to angle. They use your hand for help your foot. You they lift them by itself, go off the floor. And then you count 5 times. Slowly. Then you put them down. Then you do them back. You repeat up to 5 times. You do them morning and evening. Then exercises, then they help for build up the muscles around your joint and help for knee, for instance, around the joint, and help for distribute the weight and help for reduce your pain where you get with your arthritis. Then you get the other we then call the quadriceps. You put like a pillar or you fold cloth, you put it under your knee. You put it under this knee, then you try for lift this knee up. But the toe, this toe here for point towards you. You know, like this toe, you toe the keep and straight, you point and towards you. Then you lift her off the floor. This is not the floor, you lift her up the floor. So you do that there, and then you hold them. You keep them, you hold them like for 5 seconds, counts 5. Right? 1, 2, 3, slowly up to 5. You do that up to 10 times. This can help you for and this now another form for help if you get knee problem. Then you get the other form of exercise where you can do waiting up. Like this one, you do one if, for instance, you sit down. That one will be sit down. You will do one with you sit down. You lift your foot up. This one now with the sit down. You start with a high chair. You lift up. You know the old nothing. You under the old nothing. You touch nothing. You go up, then you can down. You go up, you can down. You know, like you squat. As you do them daily, that's why they reduce the height of the chair. That's why they reduce the height of the chair. This they build up your quadriceps and all your other muscles around your foot for help for maintain your help your knee. And then again, you get where you can cross. You can sit on a chair, you cross your foot over. Like this woman sit down, keep straight. This foot here, they up. This other foot, they down. The foot where they down, they push up. Then the one where they up, they push down. So they end up, they strengthen this, you thigh muscle and the muscle around the knee. So all the exercises there, you can see how you make ignorance say it's simple, but if you take it as a routine, as part of you, it will help you. And as we talk at the start, and we say, you get for learn for live with them. If you get a good, healthy, balanced diet, you exercise regularly, you take your medicine them, and if you take your flu jabs them, they do every year, and that they help you, because we don't talk with if you get flu, so they get flu later on, you go end up getting joint pain. So as we can always say, Wel Bodi Beteh past Gentri, we tell you thank you for listening to we. Welcome suggestion, contribution, and contribution so far, or any question. Thank you so much.
Thank you very much, Dr. Turay. Before waiting the doctor not explain to now. I remember when this topic come up, like beaucoup of we, the only way they think about say arthritis now one type play. Now don't say plenty type play, and there's a lot of reasons why they think they can happen. We're not taking a lot now. Una turn now for contribute. There's a lot of information we don't take, and so man, it will take a while for he digress, for he will understand exactly what will happen. Which you don't hear again. I believe some question will come later on. But if anybody get question now, I believe or even get a story we want to share, as long as it's short, and for other people and benefit from that, so they will understand. Gentri are not one person they suffer. There are various, as I don't say, there are various reasons why people can suffer Gentri, and there are various ways that you go able to manage them. One thing I can always say, and what I don't learn as well from the doctors there, is that some of the problems there are way we can come across. Some of we can they hope say they will give one magical pill, we're gonna make all the problem go away. Unfortunately, sometimes the problem here we go for learn, for live with them, find ways for manage the problems there. Okay, I'll go to Anne. Then if anybody else gets your hand up, and I'll come to them. Yes, Anne, how are you?
Hello. I have arthritis. Dr. Turay, I do quite a few of them exercises that you've just shown us. I have diverticulitis, which was recently diagnosed, and I've only just got medication for it. But I find sometimes that if I don't have my stick, my knees give way and I fall. So I've had a couple of falls because my actual knees with the arthritis has give way, it's weak. I have it in my shoulders, in my feet, my hands, and my back. But like I say, paracetamol and just a few light exercises, and that's all you can do. It helps you live with it. You know, there's nothing else that they can really do for you. But it can get quite painful at times. But I found since exercising, since I've been to the pulmonary course, it's helped a lot. So thank you very, very much, Dr. Turay, for that presentation. It was excellent. Thank you.
Thank you.
Thank you very much, Anne.
Thank you so much, Anne, for the feedback. You know, as I said initially at the start, you just need to learn how to live with it, and thankfully you've been able to try to do things that help you to be able to live with it. However, since there are multiple joints, and you said your legs giving way, you know, occasionally it may be good to see your doctor to investigate or see how far these the arthritis has progressed, right? And based on that, there are few interventions that they can probably consider, things like, you know, injections, as we've mentioned, and if the need for replacement surgery. I know the queue is very long, especially after COVID, but they can help. And, you know, I've seen quite a few patients when I was actively involved in orthopedics that the knee or the joint replacements really do help them. And even those with rheumatoid arthritis end up having osteoarthritis with a joint replacement. They don't have like multiple joint replacements. It helped them, and it helped them to maintain to live with it, because it reduces the pain. The medication help, and the physiotherapy help to strengthen the muscles, ligament, tendons around the joint, and then in a way help you to be able to live with it. You know, the good thing is you know how to deal with it, and you actually know that there's only very, you know, as little they can do really. But there are things that can be done, and with the advance in science these days, there are quite a few other interventions. So you can still always contact your doctor and see what else they can do for you, especially when your leg is, you know, is giving way. You're welcome.
Okay, thank you very much. There's a question from Olabisi. Is he waiting at the role of what? Chondroitin?
Chondroitin, you know, those things wouldn't they do so? And I think that studies wouldn't they try for do the essence of all landing are for try for see the synovial joint, for lubricate the joint, that synovial membrane and thing inside, put the fluid inside. So then they inject, then they give you then things, and they for see if then we will build up then things and they inside your joint for reduce that, you know, wear and tear, the bone to bone joint meeting. So it get controversy about time. You know, there are quite a few the studies, and still people, you know, they do studies them. You get school of thought we believe in, and they say it help, and they do studies them. Some of them being published in you know, with the Cochrane in review and everything. And it gets people a school of thought we not believe say it of any external advantage. You see, so yes, I remember when I was in Leeds, we do them kind, you know, studies, and they, yes, the essence of our all now for try for make sure say the joints that the cartilage and the synovial fluid and everything inside the joint try for build up, you know, and reduce the joint for be dried up.
Yeah. Thank you very much, Dr. Turay. What I want to ask something else. What I want to know is, for people in way they do sports, or people in way they do work in way require manual labor, whether for lift and carry or bend down. Say, for example, the construction worker, like the ground worker, for example, we require for the bend on the knees constantly. Now, I understand, yes, weight. Okay, Antigua, I will count to you in a bit. I think you forget.
You mute everybody, though. I think, I don't know if you don't do that.
Yeah, no, I tell you, we don't get about our counter.
Everybody else, maybe you can unmute everyone.
Okay. Yeah, so what I want to ask is, for people and what they do then kind of work in there, is there a chance, is there a high chance that then people can develop arthritis? And also, now all joint pain can link to arthritis, or you can get joint pain besides, they suffer from arthritis. Because for me, I think where I want to try to understand, I get friends that, well, me say they play sport at some point, and now all of a sudden, one, I don't know if that's because of how they play actively anymore, certain day, I can feel the joints them certain day. But also I get friends that we, through joint pain, I made them stop for play. So I want to try to understand, is it linked to certain activities and jobs that we people they do? And also, is now all joint pain linked to arthritis, or you can just get normal joint pain and it go away, or maybe it might be recurring because sometimes some of them pain and they go away. You can just manage it no more, it will cease for a bit, and after a while again, it might start. You be able to clarify that point there for me, please?
Yeah, so you get the joint, exactly the type of job we they do, they predispose you to getting high risk of getting arthritis. Like how we don't talk like the prevalence in Sierra Leone because of the manual job and everything. Footballers, them, people who then they do some kind of sports, them, so much weight on the joints, them, and they affect than they. You mentioned about people who they do ground walk, like in a building, they kneel down. Then one day they can get bursitis, when are mainly the cushion around the joint, now get problem. Sometimes now the inflammation really around the joint, the ligament and tendon, they call it tendinitis or bursitis, now can happen not to the joint itself. You can get the problem. Okay, and yes, it gets conditioned the way like Albedo mentioned, where they relate to you getting pain in the joint. Okay, pain in the joint means arthritis, right? But that don't mean say it can lead you to osteoarthritis. Okay, but the tendency that if it did only the pain in the joint might be due to the ligament or the soft tissue around, not the bone itself. Okay, if it be say it involved the soft tissue around with long time like rheumatoid, it in the go later on they affect the cartilage and the things that inside where they lead you to the arthritis itself.
Okay. There's another question there we come up for. Thank you very much for that answer. There's another question from Olabisi Claudius Cole. He say, let you explain gout and arthritis. He say because they see a lot of patients now with gout.
Okay, so gout is a form of arthritis. They can call it normally call it gouty arthritis. Waiting the lead to that arthritis day now because of normally call and say the rich man's disease, because they get some kind high protein food that we get purine in them, where they lead to uric acid. Every human being gets uric acid, but the body they try for maintain them. If it reaches a situation where the body able maintain them, it form down crystals, then they go now the joint them, they affect the joint, they damage the joint, they cause pain at the joint. With time, when they happen, you can get episodes them. It happen, then give you medication. Normally, non-steroidal anti-inflammatory, ibuprofen, naproxen, or colchicine, then can give in the acute phase for calm down that inflammation process there. Then after when that inflammation process don't calm down, then get allopurinol medication in the give, where they help for calm down the uric acid, where they reduce the tendency for get the flare up. So they get flare up on them. If then they continue, it end up each side of your joint state, it can end up getting the actual arthritis, osteoarthritis. So yes, the gout itself is a form of a metabolic condition where they lead to arthritis because it affect the joint and it damage the joint.
Okay, thank you very much, Dr. Olabisi. I hope that answer your question. Dr. Olabisi, by the way, Dr. Angela just told me, say na a doctor we practice na salon, na a physician we practice na salon, so a good way we hear from that. Yeah, Nafi.
Yes, Nadeini.
Yes, ma'am.
Thank you so much, Dr. Turay, for the wonderful presentation. That was really good. Yeah. I get a question around juvenile arthritis we mentioned. I get two parts of the question. The first part is when the beginning don't grow older, what thing they happen? Then they remain with the arthritis, or does the arthritis goes away when the person don't become an adult. That's the first part. The second part, during the time where the pikin then get the arthritis, waiting at treatment for them. Then say they do exercise and painkillers, or waiting when they do for them.
So yeah, the first part is yes. There's some pikin then as they grow old, they can go off they can end up not get her again after a certain age, they move for manage and but later in life, because they don't get arthritis and if that they don't do procedure or whatever, the tendency they can develop, osteo or other form of arthritis. And so with the pikin, and mainly they try for manage symptoms. The cause, as we say, idiopathic, we don't know the cause. They try for managing symptoms. The area of the joint will involve more. Now that joint, and they try for either use splints, use things, and sometimes injections, sometimes medication, just for maintain them. See, and you get different. Then they do X-rays and MRI scan and all that, and they foresee if how far it affects the joint, because sometimes the epiphysis that are the side the bone of fuse it, now they become involved. Sometimes they can end up getting, the epiphyseal fractures and then things like that. Then can do procedures for maintain that day. And so it depends on how it presents, how the pikin at that stage, how the joints were affected more, and then again, more try for educate the family around, say, not to the pikin fault. This just happened, and because it might affect them in mobility, affect them in schoolwork and other work them, we go do for you now, us, for let you understand, and they say, yes, this might happen, not to the pikin fault. So you get forget that the doctor, family understanding with the pikin, understanding how to manage the pikin. They say because it's really difficult. Most of them, they give them some kind plaster them for maintaining joints them, in a different way. So it really can be difficult for themselves, even not in school where they can day. So then they can use stick, use different prosthesis, just for maintaining.
Okay. Thank you very much, Dr. Turay. I want to come to Dr. Bell. I don't know, Dr. Bell, if he did in the position for talk. When it comes to Bele woman, for example, these are something where they can able diagnose before they became born, so they're able to advise the parents. That's something they're able to know. Or, is there any test they go do by the mama for, we go advise them for say, okay, there's a chance you can go come with this and begin prepare them. Waiting they come ahead and high for able to manage that picking they went, that picking they born and where they go up. Is there anything like that?
No, well, the one time arthritis during the belly, for diagnose, and most of the time the way they diagnose, already know say somebody gets arthritis now, where being the pains them, and that means now we have to be on born already. Or if they do some lab values, then you find out that some of the immune agents they don't high. You can suspect say it might get them, but unless that person being get that joint pain and that inflammation, you're not going to know if you get arthritis. On the other hand, you get pregnant women them with that can get arthritis, but then they know they transfer to pikin. I don't know that from any kind of contagious disease or anything that will transfer to the pikin. But women there we can get like a rheumatoid arthritis, for instance. During the pregnancy, the symptoms can go down because during the pregnancy, if you have to understand, say, women then therefore accept a foreign body. That picking within inside then a foreign body. So that means say the immune status of the woman they go on that is so German them. Not affect what that way they during the pregnancy. And make the woman can prone to infection during pregnancy as well. But woman they will get that rheumatoid arthritis, they can get less symptoms during the pregnancy, for instance. But then after the pregnancy, up to three months after the pregnancy, then pains then it can come back. Yeah, so then after the pregnancy, then you will start the medication, but get some medication that they can't take during the pregnancy. So after the pregnancy, they start back. But as I say, they transfer to the pikin in the belly. That's normal if there's some kind of genetic thing, then pikin might get her later on. But diagnosing arthritis, now more if you get pain, and then that's the diagnose and say this picky also gets arthritis.
Okay. Yeah, sorry if I put you on the spot on this one as well. Now, they talk about pain. Now, if Bele woman gets any form of arthritis where it can normally suffer this pain, is there any risk, say, if he wait time come for a born, if you get to go through cesarean, is there any complications in that? Then they go affect as well the kind of medication they put them on, or the decision whether for even the cesarean or not, and the pain they will maybe go suffer after, because I understand when they can do that in the afterwards and can get certain pain.
Well, as Dr. Turay said, don't say the one main problem waking in a pain. So if you think what a woman we get Bele, it gets another 3,000 grams something with the weight on top, and apart from that, then you can get other Bele woman always gain weight. Most times, not always, but most times again with. So all that is key and both the joints them. But theoretically speaking, the woman is self thinking born normally. They don't find out, say, in generally speaking, women then we get arthritis, especially this rheumatoid arthritis, before they get pregnant, and you find out, say, they're also subfertile. They know they get that much picking like a woman, we not get them. Studies don't show that as well, because as I say, all the way you get for do with the soldier man in body. If the soldier man, that rheumatoid arthritis, the soldier man the bokuna the body, then itself can affect the woman for get pregnant. But if it treats them, it can also get pregnant. But during the pregnancy, as I say, most times the symptoms they go. So the woman then can born, then can able for born normally as well. Some people then can, because of precautions, and people in the gynecologists can tend for tell the woman and they say they go for cesarean section, for make them get trained too much during the pregnancy. Well, that's not subjective. You get some doctors there we go tell patients, say, no, especially when you pay no reduce now. And if you wish for born normally, you don't need to go through cesarean section.
Okay, thank you very much, sir. Yeah, Ivan, introduce your name when you unmute.
Okay, now good evening. Good evening. Okay, Doctor, today there are a quick question I will ask. If Pekin don't go through sort of treatments like radiotherapy, but at ending point now with the complaining need and the time, now through say now arthritis to develop on just through due to the treatment we go through now they cause that.
Thank you. So this can be coincidental. It can be said the beginning then you radiotherapies and say if you don't get flu cold before, then it can get transient synovitis. It can be possible. Yes, we don't go radiotherapy. Then they affect the person in bone, they became bone and all anything in this. So because they affect the bone itself. So tendency they say yes, it can predispose to them, but it's not really like a hard and fast rule saying that the radiotherapy we don't do and cause the arthritis. It depends if they do and directly to the joint, involve the area of the joint, then yes, it possible say yes, that can be the case. So it's not hard and fast rule say because you don't do radiotherapy, you don't get joints, so that means that radiotherapy now cause them. It may be coincident to other thing. So they need for like an investigator and see if indeed it get linked to that rheumatoid to that radiotherapy there or not.
Okay, thank you. Okay.
Thank you very much, sir. Another question, to be honest, is very, very, very good. Now from Auntie Nafi, is there a link between arthritis and sickle cell? Because we know, say, sickle cell, then can they suffer pains to the joints and stuff like that. Then obviously arthritis as well, not pain to the joints. So is there any link between them?
Yeah, I think Dr. Kumar will do a presentation on sickle cell, wherein you get then, then crisis them where they happen all over. And so because of the crisis, then they get pain there everywhere. May not necessarily mean say the osteoarthritis now you don't get, okay? But maybe because of that, it gets the inflammation around the joint. Sometimes can cause the pain here and there, fleeting, arthritis, swelling here and there. So then they can be at any pain to the joints now a form of arthritis. Say, okay. But that normally say specifically we can't get arthritis. Then it gets another thing which can happen when people get sickle cell, because of that sequestration into the blood vessel, it reduce the blood supply to certain joints. Them, like the hip joint, it gets supply to them. Where it reduce, then it gets certain area of the hip, they begin die with time. Okay, and later on in life, they get arthritis they develop as a result. Then they get a similar condition with small beginning, they call them Pathy's disease, wherein the area of the hip joint, just the outside the blood supply they come, you get different distribution of blood supply to the hip joint, where that area because the blood supply they shut down, that area they die. And then it is a part of the instead of the round concave shape of the round shape of the femur, the hand of the hip, it chip out. And then begin get pain. Then they see they move now on a different side. Then they change your posture. You change your center of gravity as I talk, put more weight on one side. So you begin get pain from a hip, they radiate into the knee. When a radiation pain, we know to actually the knee get the problem and the hip get the problem. See, so yes, it can lead into denting and as a result of that, a pathophysiology. So you need for like really examine them and take the history from the Peking and the family and everything for no say this na the congenital condition that we get, we result to on the sickle cell and only to yes, it can possibly call it a vascular necrosis of the hip or the knee can happen with people with sickle cell. I hope that's helped.
Yeah, I hope so that they answer the question. We can't wrap up for today. But dear, I get maybe one, maybe two questions after this. When it comes to African community, most of we believe say arthritis is more prevalent in women them, and most women them we don't they carry age. But as what you don't say today, it seems like say not just women and no more. So you able to give me just a little bit more for let people understand, whether there's a balance, whether not equal between men and women, or if there's a difference, whichever side gets greater, is there a reason why that side they get greater? I mean, if a woman they get more than men, is there a reason why? And also what I want to know, I don't know if Fatima be there for be asking this question. Why make this sickness they so much in our community? Now, it linked to anything we eat, maybe, or our lifestyle, or what?
Well, we don't mention. I think that thing slide about salon, prevalence give a lot of things, malnutrition, one thing, because the bone they need nutrients themselves for let them develop, calcium and everything. And most of them in bone in the 30s or so, 30s, 40s, they get the strongest bone basically. So if they get good nutrients, it lead to certain conditions like rickets and all the rest will they happen because it lacks certain minerals them in the bone from way small. So yes, then they can predispose to them things and then the other question you talk about
between man and woman, would are more susceptible to the disease, to the illness.
Well, women they're more really susceptible. Like in osteo, some studies they say man and woman equal, but in rheumatoid, female more, and young people can affect them, and because of autoimmune condition, things like SLE, again where they happen more common, 6 times more common in women as I've been talking, and for systemic lupus. Or discoid lupus, more common in African people. It's based on studies them where they don't do, not say yes, it affects and this group of people much more than the other. But you know, also with age, it can be increase, you know, as you grow older. But then the demographic they change now, because most man them then they do involve in more manual work and all internet. So then they cause them more prone to but again, woman they
I'm sorry, I get for laugh.
woman and man again they do the same thing. So yes, women are more prone to certain one, almost like the autoimmune one, then the SLE, the rheumatoid, and the osteo. Some studies says equal. Some studies says women slightly than men, but it's different. So it depends on the area where they look at.
Thank you very much, Dr. Turay. On that note, we look at. Listen, I'm not saying anything. I'm only responsible for what I see. Whatever somebody wants to insinuate, I'm not responsible. We found when I take on our plenty, thank you. But I don't stay with you. Listen, Dr. Turay, plenty, thank you. I'll go around the panel now for everybody say the last word, and then we said we play off. Dr. Bell, I'll start with you.
Yeah, Dr. Turay, thank you very much for that topic. That was very, very good. I mean, we give a lot of information about this sickness, and I believe say we don't at least give this information out to make people know and make people aware. Say, we have this condition. We're very bored, you know. And concerning this woman and man, yes, we know say women they're more prone to arthritis than men. And some people then they say, okay, also therefore deal with say the women and joints they're not they're more unstable than the men and joints. They move more than the men and joints them. So anyway, in the woman and joints they move more, they prone more to injury. And the other thing is that women they wouldn't go into the menopause as well. The estrogen level, the human hormone level, they decrease, and through that they also get bone issues them as well, and we could also cause them to get more osteoarthritis as well. So as Dr. Turay said, on talk, nutrition is also very, very important, especially when it comes to gout. You know, Salomon they like for it's we go to beef and drink with beer for the avoid anything in the because then they definitely and also weight. Check your weight, and the problem with arthritis and weight as well again is that when you get the arthritis, the more you know the move, that the more you begin it's more, and through that it wasn't condition. You know, swimming and riding bicycle very good. Yeah, I can tell a patient and say I think they are a good jogger. I mean, we know about weight, swimming and riding bicycle very, very important. I don't know, with salon and riding bicycle and traffic and the potholes them. I don't know now that they do for the spine but for the spine, but now for at least for the in Europe, we always say swimming and bicycle. Very important topic. Please on spread the word out. Tell that people, especially when we get the arthritis, especially the one where they suffer from arthritis, let them do the exercise that we Dr. Turay will say for them, because when body better pass gently.
Thank you very much, Dr. Bell. Dr. Rashid?
Good evening. Dr. Turay, plenty thank you for this wonderful presentation. I think una don't hear it so much. I no need for bother una again. However, just for comment on my question, one of your question, about sickle cell and arthritis. Sickle cell always hereditary. That is genetic origin, whereas arthritis not necessarily hereditary, which means if the mommy and the daddy they will to get sickle cell, then the tendency for person to a certain percentage of lymphopenia is very likely, whereas that case is different in arthritis. But also the mechanism of pain is different between the sickle cell and the arthritis. The pain in sickle cell are because the red blood cells, where they carry oxygen, then they sickle, then they form that sickle shape. It's so difficult for them pass through the small blood vessels. Therefore, pain they occur, and more so where oxygen not they reach the tissues. On the other hand, in arthritis, now because of the wear and tear, as Dr. Turay put it. Either way, no matter for the patient still they get pain. So, but that's the difference there. So thank you, Dr. Turay.
Thank you very much, Dr. Rashid. Dr. Angela, you still there with me? Okay.
Good afternoon, everyone.
Yeah.
And thank you very much, Dr. Turay, for the presentation. I want to give a special shout out to Dr. Olabisi Colonial School for una we no know am na a practicing physician, na me own personal posting, na me god mami, literally na one of the people that will inspire me for do medicine. And I think for my medical school, for putting and they were learn na Dr. BC in clinic, even before they teach me in medical school. So I believe some of the questions the women they ask now like he may say, I think one of the questions, I think he may say they see a lot of gout, so I know gout related to arthritis or something like that. Anyway, Dr. Cole, thank you for joining us, and we look forward for seeing you more often. But thank you very much, everyone. I don't need to go over all the points them. On a waiting, the experts don't talk. On a we all try. I think maybe the next presentation most likely we'll talk about exercise, and I'm really glad that Dr. Turay, one of his last slides, them talk about exercise and arthritis. So next presentation, hopefully we'll talk more. But if they suffer from any form of arthritis, or you know about somebody who they suffer from, encourage them for watch this recording, and if they get any question, then can always contact me. So now all know Wel Bodi Beteh Gentri. And I thank you for joining me.
Thank you very much, Dr. Assis. Fine talk. Auntie Gugi?
Yes, thank you very much, Dr. Turay, for the presentation. Now, just like how Timothy you say, I suppose a lot of people as well, we know a bit of some arthritis, for say Arthritis Day, you understand, but waiting Dr. Turay don't talk with the different type, it just astounding for no for say different type than they, well, we not even know. We not just waiting to see them, the hand, the back, the knees them, especially the knees them. You understand? So majority of we they suffer eventually from arthritis. Now the only thing we want for say no more as well. Now for let we not forget mental health with arthritis or any kind of sick self we go through, because sometimes when pain so they flare up for some people, they affect them very, very badly, because for say your life don't stop for that meantime day. Some people then go begin to get anxiety. Some people go get depression. Some people then go really it go affect them. And for just support that person, they support the family and no sort of put them more for tell them more for anything. Especially with picking them as well. When they talk about picking them, whether pain they meet or they flare up, how then they feel, their self-confidence, their self-esteem, and how then they see them company and they play about, then they're not going for do that one day. So now for encourage them a lot and not for go over the top, for let them not feel for say, oh, na then no more, na then they struggle like that one day. So again, as we all don't say, Wel Bodi Beteh Gentri, now for like we all look after ourselves. And I'm glad you for the exercise. The only one thing where I want for put back on that exercise thing day, for say not to for do on 1 10, 2 10, 3 10 no more and forget about it and say, well, I don't feel better. That's the end of it. You understand? You get for keep going like anything, not to 1 10, 2 10 no more for say everything will work. You get for now continuous still you get for do for like it make your life better, because arthritis, it come sometimes na flare up something day, now on and off. Some people and they go up, you go, they go able for cope with them, other people and they not go able. So for support them and the GP them for be able for support the patient them as much as possible. Africa, I don't know how what I go say safe, how they're able to deal with things like now and then.
Okay.
Thank you.
Thank you. Thank you very much, Auntie Wiggy. Dr. Kama, I don't know if you didn't work. Okay. Dr. Turay, I can't give you the last word for later people them, but also giving you your experience you get in a salon compared to some of we not get experience there. If you can touch a little bit as to when you feel say with people in a storm for go see the doctor or when them for go emergency, then you give a round up on that, then that'll be good for today, please.
Okay, family, thank you for join me. Thank you for all the contributions them wanna make. We'll not go over to don't talk again, but again, if any of which we don't talk, una feel say a need for that we go into any of the topics then in more detail, we're more than willing to do so. And like how Dr. Hansi say for the exercise then and posture, each other joint exercises that we talk about or we want to get a feel of, let we know we can talk about them. And definitely salon we get different we don't touch on the type of arthritis that we can happen. Cervical spondylosis we don't say and the boku but they not normally diagnose and so again you need some specialist physiotherapists them for help in that perspective. For say when for go see person, for go see doctor.
Yeah. Or when for go emergency.
Well, for go emergency, so say you go emergency hospital, then they go just get arthritis, you pain, they go emergency straight away. That's not an emergency. Okay, osteoarthritis is not an emergency. Yes, if you get gout, for that pain, the pain they make you go there, for let them go give medication and distinguish them from infection. Yes. The most one way na emergency na septic arthritis, right? So septic arthritis na the major emergency na any orthopedic place where they need for go drain that joint, wash the joint, pull in, reduce the infection there. Taking antibiotics over the counter, not they help that side because it may not penetrate the joint even they need for go wash out. And if you get that pain, you don't even move the joint in any way, let them go, then go investigate. So then they can start from blood test and we don't say this now joint infection. They need for be washed out. So that's now one of the major thing we need for go emergency. The other thing, if you get accident, we involve the joint, then everybody know that they get accidents involving joint, you need for go day. But just for osteoarthritis, no need an emergency. Rheumatoid, yeah, you need for go see your doctor, then go do early diagnosis and start the treatment early. So that most of the thing and Andy. So I hope say Danny will be helpful. As I say, if any of the topics then people want to talk on again, we're more than willing for do so. We're more than willing for delve into some of the treatments. And the treatment sometimes is specific to the individual. Exercise, most people then they ignore them. But exercise goes a long way. And then splint and then soles, they will be the talk about, then devices the way they use. You ignore them thing and day, but then they help you. Then shock absorbing soles that they put in your foot, when I shoes, you they ignore it, they help you in the long run. So I hope say and that's help, and we want let people until we're waiting the one to talk about. I know what I talk about, it's so much, it's difficult for Lego grasp everything, but we're more than willing to repeat any one of them at a specific topic. Thank you.
Thank you very much, Dr. Turay. So this is for me now from the people we don't learn boku plenty thank you. The biggest thank you to una we join the program. Because if we didn't ask, we talk to ourselves, it not gonna mean anything. But una we join na una they make we continue for do. And by God power, we work very hard for like come to mainstream TV or radio na salon. By God power, when it come there, we go make sure so una know and more people will benefit. As Dr. Hansis will say, most likely the next session it will be exercise. So they have a fun with them. Let's join, let's see the exercise when the normal exercise, not the exercise when as some of sabi. So till we meet again, Wel Bodi Beteh by Gentri. Good night.
So which exercise?